Welcome to our video on the 6 kidney failure symptoms you should never ignore. Recognizing the signs of kidney failure early can be crucial for seeking timely medical intervention and preventing further complications. In this video, we'll explore 6 key symptoms that may indicate kidney failure. If you notice any of these symptoms, it's important to consult with a healthcare provider immediately. Before we get started, please don't forget to click the thumbs up button and subscribe to our channel to help us reach more people. And click the bell icon so you can be the first to know when our latest video comes out. Now, let's dive in. Starting our countdown at number 6 is swelling, also known as edema. Swelling in the legs, ankles, feet, or hands occurs when the kidneys are unable to remove excess fluid from the body efficiently. Normally, the kidneys filter out waste products and excess fluids from the blood, which are then excreted as urine. However, when kidney function is impaired, this excess fluid can accumulate in the tissues, leading to noticeable swelling and puffiness in various parts of the body. Edema is particularly noticeable in the lower extremities, such as the legs, ankles, and feet, because gravity causes fluid to pool in these areas. You might observe that your shoes feel tighter, or you notice indentations on your skin after removing socks or footwear. This type of swelling can make walking uncomfortable and can interfere with your daily activities. In severe cases, the swelling can become so pronounced that it affects your ability to move around freely. One of the key concerns with edema is that it can indicate a significant fluid imbalance in the body, which can have several underlying causes. In the context of kidney disease, the kidney's inability to excrete sufficient fluid leads to its accumulation in the body. This fluid buildup not only causes swelling but can also increase blood pressure, adding extra strain on the heart and blood vessels. Over time, this can lead to more severe cardiovascular issues, which are common complications in individuals with chronic kidney disease. Edema is particularly concerning because it can also lead to shortness of breath if fluid accumulates in the lungs, a condition known as pulmonary edema. Pulmonary edema occurs when fluid leaks from the blood vessels into the air sacs of the lungs, making it difficult to breathe. This can cause symptoms such as difficulty breathing, especially when lying down, a feeling of suffocation, and a persistent cough that may produce frothy sputum. Pulmonary edema is a serious condition that requires immediate medical attention, as it can be life-threatening if not treated promptly. Other symptoms that may accompany edema in the context of kidney disease include weight gain due to fluid retention, high blood pressure, and reduced urine output. Next up at number 5 are changes in urination. The kidneys are responsible for filtering waste and excess fluids from the blood to create urine. Any significant changes in urination patterns can be a red flag that your kidneys are not functioning properly. These changes can manifest in various ways, and being aware of them can help you identify potential kidney issues early on. One common change is urinating more frequently, especially at night. This condition, known as nocturia, can disrupt your sleep and may indicate that your kidneys are not concentrating urine properly. Frequent urination can also be a sign of other conditions, such as urinary tract infections or diabetes, but when combined with other symptoms, it can point to kidney problems. Experiencing difficulty urinating is another concerning change. This might include straining to urinate, a weak urine stream, or feeling that your bladder is not emptying completely. These symptoms can suggest blockages or other issues within the urinary tract, potentially related to kidney stones or an enlarged prostate in men. The appearance of your urine can also provide important clues about your kidney health. For instance, urine that is foamy or bubbly can be a sign of proteinuria, a condition where protein leaks into the urine due to damaged kidneys. Normally, protein should remain in the bloodstream, but when the kidney's filtering units are damaged, protein can pass into the urine. Proteinuria can be an early indicator of kidney disease and should be evaluated by a healthcare provider. Dark-colored urine can indicate dehydration, but if hydration levels are normal and the urine remains dark, it could be a sign of blood in the urine, hematuria. Hematuria can cause the urine to appear pink, red, or cola-colored, and may be due to various reasons, including kidney stones, infections, or more severe conditions like glomerulonephritis or kidney cancer. The presence of blood in the urine should always be promptly investigated by a healthcare professional. Additionally, noticing blood in your urine is a serious symptom that warrants immediate medical attention. Blood in the urine can be microscopic, not visible to the naked eye, or gross, easily visible, and can be associated with kidney infections, trauma, or malignancies. Even a small amount of blood in the urine can be significant and should not be ignored. These changes can indicate that your kidneys are struggling to filter out waste effectively. The kidney's ability to filter and eliminate waste products is critical for maintaining overall health, and any impairment in this function can lead to the buildup of toxins in the body, causing a range of symptoms and complications. If you notice any unusual changes in your urination habits, it's important to seek medical advice. Early detection and diagnosis are key to managing kidney disease and preventing further damage. Your healthcare provider may perform various tests to determine the underlying cause of the changes in your urination patterns, including urine analysis, to check for protein, blood, and other abnormalities. Blood tests, to evaluate kidney function by measuring levels of creatinine, blood urea nitrogen, BUN, and estimated glomerular filtration rate, eGFR, and imaging studies, such as ultrasounds or CT scans, to visualize the kidneys and urinary tract and identify any structural issues. In some cases, a kidney biopsy may be necessary to diagnose specific types of kidney disease. Coming in at number 4 are fatigue and weakness. These symptoms can be particularly telling when it comes to kidney disease, as they often indicate underlying issues with kidney function. The kidneys play a vital role in producing a hormone called erythropoietin, EPO, which is crucial for stimulating the production of red blood cells in the bone marrow. Red blood cells are responsible for carrying oxygen throughout the body, and adequate levels are necessary for maintaining energy and overall vitality. When kidney function declines, the production of erythropoietin decreases significantly, leading to a condition known as anemia. Anemia results in a lower than normal number of red blood cells, which means that less oxygen is being transported to the body's tissues and organs. This lack of oxygen can cause persistent fatigue, weakness, and a general feeling of tiredness, even after getting adequate rest and sleep. You may find it challenging to perform everyday activities or feel exhausted after minimal exertion. In addition to anemia, the buildup of toxins and waste products in the body due to impaired kidney function can also contribute to feelings of fatigue and weakness. Normally, the kidneys filter out waste products from the blood, but when they are not functioning correctly, these toxins accumulate, leading to a condition called uremia. Uremia can cause a range of symptoms, including fatigue, nausea, and a general sense of feeling unwell. The presence of these toxins in the bloodstream can interfere with cellular functions and energy production, exacerbating the feeling of tiredness. Furthermore, kidney disease can lead to metabolic acidosis, a condition where the body produces too much acid or when the kidneys cannot remove enough acid from the body. This imbalance can contribute to muscle weakness and fatigue, as well as other symptoms such as shortness of breath and confusion. Persistent fatigue and weakness can significantly impact your quality of life, making it difficult to carry out daily tasks and enjoy activities you once found fulfilling. At number 3 is persistent itching. When the kidneys are not functioning properly, waste products can build up in the blood, leading to a condition known as uremia. Uremia occurs when the kidneys fail to adequately filter out toxins and waste products from the bloodstream. This accumulation of waste products can have several adverse effects on the body, including severe itching, which can be extremely uncomfortable and disruptive to daily life. Persistent itching, also referred to as pruritus, is a common symptom among individuals with chronic kidney disease, CKD, particularly those in the later stages. The exact cause of uremic pruritus is not entirely understood, but it is believed to be multifactorial. Several factors may contribute to this condition, including high levels of parathyroid hormone, calcium and phosphate imbalance, and the accumulation of metabolic waste products. One potential contributor to persistent itching in kidney disease is the imbalance of calcium and phosphorus levels in the blood. When kidney function declines, the regulation of these minerals is impaired, leading to elevated levels of phosphorus and decreased levels of calcium. This imbalance can cause mineral deposits in the skin, leading to itching. Additionally, elevated levels of parathyroid hormone, which occurs as a response to low calcium levels, can further exacerbate the itching sensation. Another possible factor is the accumulation of uremic toxins in the blood. These toxins, which the kidneys are unable to filter out effectively, can stimulate nerve endings in the skin, causing an intense itching sensation. This type of itching can be widespread, affecting various parts of the body, and is often described as deep and relentless. Persistent itching can significantly impact the quality of life for individuals with kidney disease. It can lead to sleep disturbances, anxiety, and even depression due to the constant discomfort and frustration. Scratching to relieve the itch can result in skin damage, infections, and further complications. Next up at number 2 is shortness of breath. Kidney disease can lead to difficulty breathing for several reasons, and understanding these can help in recognizing the severity of the condition and seeking appropriate medical care promptly. Firstly, one of the primary functions of the kidneys is to remove excess fluid from the body. When the kidneys are not functioning properly, this excess fluid can build up in various parts of the body, including the lungs. This condition, known as pulmonary edema, occurs when fluid accumulates in the air sacs of the lungs, making it difficult to breathe. The sensation can be similar to drowning, causing significant distress and discomfort. Pulmonary edema can lead to symptoms such as difficulty breathing, especially when lying down, a feeling of suffocation, and a persistent cough that may produce frothy sputum. Secondly, kidney disease often leads to anemia, a condition characterized by a lack of red blood cells. The kidneys produce a hormone called erythropoietin, which stimulates the production of red blood cells in the bone marrow. Red blood cells are essential for carrying oxygen from the lungs to the rest of the body. When there are not enough red blood cells, the body's tissues, including the lungs, do not receive adequate oxygen. This lack of oxygen can make you feel short of breath even with minimal exertion, as your body struggles to meet its oxygen demands. The combination of fluid buildup and anemia can significantly impact your respiratory function, leading to persistent and unexplained shortness of breath. This symptom is not only uncomfortable but also a serious indicator that your kidneys are not functioning properly and that you may need urgent medical attention. In addition to these primary causes, other factors associated with kidney disease can contribute to shortness of breath. For example, high blood pressure, which is common in people with kidney disease, can strain the heart and lungs, further exacerbating breathing difficulties. Additionally, electrolyte imbalances, such as high potassium levels, can affect muscle function, including the muscles involved in breathing. Topping our list at number 1 are nausea and vomiting. When the kidneys are failing, they are no longer able to efficiently filter waste products and toxins from the bloodstream. This leads to a condition known as uremia, which is characterized by the accumulation of these waste products in the blood. Uremia can cause a variety of gastrointestinal symptoms, including nausea, vomiting, and a loss of appetite. Nausea and vomiting are particularly concerning symptoms because they can significantly impact your quality of life and overall health. The constant feeling of nausea can make it difficult to eat, leading to a reduced intake of essential nutrients. Vomiting can exacerbate this issue by causing you to lose the nutrients and fluids that your body needs to function properly. This can result in malnutrition and weight loss, which can further weaken your body and make it more difficult to manage kidney disease. The buildup of toxins in the bloodstream due to kidney failure affects various systems in the body, including the gastrointestinal tract. These toxins can irritate the lining of the stomach and intestines, leading to persistent nausea and vomiting. Additionally, uremia can alter the way your body processes and responds to food, causing a loss of appetite and changes in taste, which can make eating even less appealing. Malnutrition and weight loss caused by nausea and vomiting can have serious consequences for individuals with kidney disease. Malnutrition can weaken the immune system, making you more susceptible to infections and other health complications. It can also reduce your body's ability to repair and maintain tissues, which is particularly important for managing chronic conditions like kidney disease. If you experience persistent nausea and vomiting, it's essential to seek medical attention immediately. These symptoms can be indicative of advanced kidney disease and require prompt evaluation and treatment. Your healthcare provider may perform a variety of tests to determine the underlying cause of your symptoms, including blood tests to assess kidney function and levels of waste products in the blood, urine tests to check for abnormalities, and imaging studies to evaluate the structure and function of the kidneys. And there you have it, 6 kidney failure symptoms you should never ignore. If you notice any of these symptoms, please consult with a healthcare provider as soon as possible. Have you or someone you know experienced any of these symptoms? How did you manage or address them? Please share your experiences in the comments below. We'd love to hear your stories and tips. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and click the bell icon to stay updated with our latest health tips and information. Thank you for watching, and take care of your kidneys and your health.